And I would make sure I know it inside out because I don't want to lose this game. I know I'm not good in histology, ideally. I know I hate anatomy. I hate pharm, but I'm good at it. I don't like epi. I don't like biostats. I don't like embryology. So I have to make sure I'm stronger in other things. Pharmacokinetics, don't like. Pharmacodynamics, I'm backwards in. But if you ask me anything about chem, I'm pretty good. I know about the genetics, I know about the metabolism, I know about the vitamins. So you have to figure out for every system, which I figured out for you, by the way, where you can strengthen your knowledge and your points. If you think this way, you pass. But I know a lot of you, even though you hear me say this all the time, and I do care for you, I know you all want to learn it. The problem was that, and the problem is that in med school, you learn what you can. Every school is different. Curriculum is usually the same, but there's different professors, MDs, PhDs. Then you have different students. Their attention span is different. The lectures are different. So if you think about it, you have to take a step one exam, which is a final exam of all basic sciences. And I know a lot of you are overseas too. I have doctors from India, from Europe, South America, from Asia, from Africa. Your schools and your curriculum and your hospitals aren't tailored to the USMLE. They're just not. So it's hard. It's hard to accept and learn different ways to master the material. But for example, when I say pharm, it's simple, it's universal. This is the drug, and this is what it does. And we need to know what it does because we need to know how to stop it from, I mean, for example, we know how the drug is working, but for example, if you talk about like virulence factors in microbiology, we need to know how bugs are resistant towards our medication towards us. So that's why MOAs are very important. And if you're talking about adverse effects, I know they're challenging, but if I throw at you two drugs, vincristine and vinblastin, you might not remember what they are. I remember they're in the M phase. Kristen, I think of crisping the nerves, so it's peripheral neuropathy, and blastin, blast the bone marrow, myelosuppression. Okay, so out of the thousands of things we have to know every day, and out of the hundreds of thousands of things that we have to recall, on exam day, if they throw at you a certain drug, you have to have that hook, that opportunity to say, you know what, I will leverage this exam. I have first aid. I have a QBank, AMBOSS, UWorld, Kaplan, and I know they will ask me some drugs. So what I did today is I created 85 questions from AMBOSS. Drugs are universal language for us because, guys, physiology is hard. I know phys. I try to teach it when I can. You have pathophys, you have pathology. That can be challenging because you need to know about the different ins and outs, preload, afterload, afferent, efferent. I mean, once you get it, you get it. But I figured, how can I help everyone? How can I help you guys pass? And I know this works because I've had doctors that have reached out to me that in less than 30 days with a decent basic science foundation and consistent working every day, they were able to really pass their exam because they figured, okay, immunology, I'm weak in. Micro, I suck. Details, I don't remember. Biochem, I'm weak in. And these are three topics that you do at the beginning of med school. Then you figure pharmacology is found in every organ system, heart, lungs, kidney, so on, so on, so on. So I could do that. And then in pharm, we have MOAs, adverse effects, synergistic effects, and whatnot. And then you have cancers. And then in every organ system, you have certain topics, right?